Hi, Terry Schoenfeld for UAB School of Medicine. In this video, I want to discuss what clinical practice guidelines are. We'll talk about it, the definition of a clinical practice guideline, and also I'm going to cover what makes a guideline trustworthy.
So the definition of clinical practice guidelines has evolved over time, but the current definition as put forward by the Institute of Medicine is that clinical practice guidelines are statements that include recommendations intended to optimize patient care that are informed by a systematic review of the literature and an assessment of the benefits and harms of alternative care options. And I've highlighted on my own in green what I think are the most important components of the definition of a clinical practice guideline. Now, the Institute of Medicine also put forward some standards that guidelines should meet to be considered trustworthy. And importantly, they need to be based on a systematic review of the existing evidence. Now, there are times when opinion has to be interjected into guidelines, but that should only occur when there's a lack of evidence. You want to see that the authors of the guidelines did a very broad review of the literature of both positive and negative studies when considering recommendations to make. Importantly, the group that develops guidelines should be a multidisciplinary panel of experts, and importantly, representatives from the key affected groups. So one of the problems that you see with most guidelines is that they're single specialty society developed. So for example, a group of cardiologists get together and make recommendations on management of congestive heart failure. Well, the problem there is a lot of other people besides cardiologists take care of patients with heart failure. And patients with heart failure often have other diseases that are not considered by these guideline developers. So it's important to have other folks like primary care groups, patients themselves on these panels to make sure that all points of view are included when making recommendations. Similar to what I just said, you should consider important patient subgroups and patient preferences especially as appropriate. One of the things that's really lacking from a lot of guidelines are patient preferences. Just because evidence shows we should do something, patients don't often want to do that, and so their preferences and values need to be taken into account when making recommendations. Importantly, guidelines should be developed on a very explicit and transparent process. Unfortunately, it's very opaque, most guideline development processes. And the reason we want to be able to see what these guideline developers are doing is so that we have minimal bias, and importantly, we need to determine the conflicts of interest of the people who develop the guidelines. There's a lot of conflicts in guideline development, and I'm going to make a separate video on problems with clinical practice guidelines, and I've written on this before in a variety of editorials. And an important one is really this conflicts of interest, and I'll expand on that more in my other video. There's often different options that can be taken for treatment or diagnosis, etc. And so what we want to see in a guideline is that the authors explain these alternative care options and what effects that has on health outcomes. We like to see that they grade the quality of the evidence so we get some sense on whether their recommendations are based on very good evidence or sort of scant, poor evidence. And we also like them to grade their recommendations so we know, is this a really strong recommendation or is it mostly opinion, and we need to take that recommendation with a grain of salt. Finally, guidelines need to be updated. Evidence changes rapidly, and we need to see that they have a regular sort of expiration date and that they're revised on a regular basis. Sometimes this is very difficult to detect, but often there's a little line near the end or the very beginning, often not in the main body of the guideline itself, but sometimes in sort of very small subtext of when they plan to re-review the data and see if a new set of guidelines is needed. So hopefully you get a sense that guidelines go beyond just reviewing and summarizing evidence. So a systematic review just reviews and summarizes evidence and it does nothing else. But guidelines go beyond that because they take that evidence and then develop recommendations on what to do. Now, guidelines seem like a really good idea, but I think Alan Detsky really summarized the problem with guidelines. And that's that these guidelines take information and make subjective judgments of converting that information or data into recommendations. And it's important to remember that these are often very subjective judgments, and these judgments are prone to error and especially importantly prone to bias. And we see examples of this all the time. There are multiple guidelines often on the same topic, often reviewing the same evidence, but they make different recommendations. Why is that? Well, their recommendations or the data is filtered through the prism of the guideline developers into recommendations, and that prism is biased often. We all have our own biases. So just keep that in mind, that if it's developed by a multi-specialty group of people, it's less likely to be biased, but unfortunately, like I said earlier, most guidelines are single specialty developed guidelines, and Dr. Detsky's statement here is very true about the result of many guidelines. So remember, guidelines are not infallible. They are flawed. Sometimes they make recommendations that are just wrong. And they, importantly, do not fit every clinical situation. Unfortunately, guidelines have been bastardized into performance measures and to a one-size-fits-all model. And that's not the case. Patients are very different than the data upon which recommendations are made often. And so you have to adapt a guideline and to see if it fits your patient. It might not always fit. And when you force one-size-fits-all mentality, you often will do things to patients that is not needed. And they should never be a substitute for clinical judgment. So I'll end on that point. Remember that they are just guidelines. They're not meant to be strict rules, but unfortunately we've often converted many of them into strict rules.
I hope this video has helped you understand definitionally what a clinical practice guideline is and what makes for a good guideline. If you have any questions, you can contact me through the course website or through the Contact Me section of my blog. Have a great day.